Great question. And I think one of the reasons you and I have come up with talking together about this is because of the need for it. And I am such a strong advocate of always mixing counselling or some kind of talk therapy or understanding with things like acupuncture and other somatic healing processes, because like you say, we can release something. I think the starting point is for therapists to either to acknowledge or realize whether or not they actually have counselling qualifications or not. Some of you may not. Just recognize where you're up to and what you're able to provide, and not stepping over if you're not able to provide, so that you're not causing more harm. But to go in with a really open mind and recognize that even though you do this all day, every day, because this is your job and you may be very good at it, the person on the table, this is either new to them or they're coming to you because of a pain, whether it's a physical pain, an emotional pain, an old trauma or a new trauma. So just to have a real awareness that this person is coming to you in a vulnerable state, and part of your job is to actually take care of them and make sure they're okay physically and mentally. And when something does come up, to not just kind of brush it off because you're used to seeing reactions, because this may be a first reaction or an extreme reaction for them. I mean, even in my own personal experience, I've had acupuncture a bunch of times. I have very extreme reactions to acupuncture. I've had one with Jim also. I have very extreme reactions to acupuncture. And to be honest, it scares the life out of me. And I'm trained in trauma and trained in counseling, and it freaks me out. So imagine you have no qualifications in emotional healing or mental health, how scary this can be. So really be aware that whilst this might be your normal day-to-day for your existence and your work, for them, this is a big experience, and to take time to recognize that each person will have a very different reaction. It out.
Yeah,
We tend to, with emotion, shove everything back down. And I always liken that to if you get a balloon and you try and jump in a swimming pool and try and push the balloon underwater, it's going to pop back up. And you push it down and it's going to pop back up. And it's going to keep happening your whole life. If you take all your emotions and you keep just trying to shove them down, they're just going to pop back up. So rather choose when they pop up, choose